how are you going to make them invested in your problem? You have to know what is in it for them, and you need to know how to communicate that.
Hi, I'm Caitlin,
And I'm Clarinda,
and this is Not Just Patients.
a podcast where we break barriers to meaningful patient involvement in healthcare.
Thank you so much for tuning in today. On today's episode, we have Urvashi Prasad, who's going to be talking to us about patient involvement in shaping health policy.
Urvashi was a director in the office of the Vice Chairman, Niti Aayog, the Indian government's premier policy think tank chaired by the Prime Minister. With extensive experience in health, nutrition, sanitation, gender, and public policy, she has been a part of the core team supporting the work of Government of India's Empowered Group 1 for managing the COVID-19 pandemic in India. She co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in 2017. Urvashi has over 100 publications to her credit and is the recipient of multiple awards and honors, including the India UK Achievers Honors, the Healthcare Changemaker Award, and the Most Influential Women in Healthcare recognition. She has been living with stage 4 ALK positive lung cancer since 2022. Urvashi, what an honor. You embody everything that Not Just Patients is about and the spirit of that. And it's just such a privilege and pleasure to have you here. So thank you for joining us.
Thank you for having me here.
So maybe to begin with, I think health policy seems like such a big and broad term. And for a lot of people, like me and Caitlin, it seems like something that's very far removed from the daily life of patients. So maybe we can start by just defining health policy and the different areas it covers.
Yeah, so you're right. Health policy is a very broad term, and it's also broad statement that any organization comes out with. Now, of course, it can be at different levels. It can be at a international level, it can be at a national level, subnational, even local, even organizational level. And generally, it is talking about the actions that we need to take in different sectors to be able to improve health status. Of course, we define what we mean by health status, and we also define what we mean by the kind of actions or interventions. So, whether it's something on the side of prevention or disease cure or palliative care. So, basically, it's a very broad, generally a document, which will kind of guide the kind of interventions that any, like I said, depending on which level it's happening, any organization or any government would want to undertake to achieve certain health goals. And when we have a policy, we talk about how we're going to use technology, we talk about who are the stakeholders involved, we talk about, what is going to be the measurement and how frequently are we going to do it, how are we going to measure our goals. So all of this is there, but it's generally at a more high level. And then it is from this policy that we then derive more specific initiatives or schemes or programs or whatever it is. So it's like an overarching vision really for, where you want to go and what you want to achieve.
That's really helpful as an overview. And I was wondering if you could give us some examples of some health policy issues just to contextualize that a bit more.
So, you can have policy, and we do have also around, say, something like antimicrobial resistance. How would you tackle that? That, for instance, can be at an international level because that's not just a country specific issue, but that's a cross border issue. So, that is one area where you can kind of say, okay, this is what we need to achieve in this domain, and this is how different stakeholders need to work together. These are the kind of interventions we need. So that's, one example of having a health policy. In India, we came out with a national health policy in 2017, which was at the central government level, which kind of set out, what are the targets for India as a country,
Mm.
and what are the kind of areas we need to work on to achieve those targets. So, again, a very broad document because every state in India has its own contextualization of that broad policy, but that kind of provides a direction for where the whole country needs to go eventually. The public sector, the private sector, everybody needs to come together and work towards those goals. So it can be at different levels, and it can be either at a sector level or it can be on a more specific topic, like I said, the antimicrobial resistance, or it could be access to vaccines. Any of these issues are suitable for having policies around.
Yeah, that makes it extremely clear. So thank you for that. That's helpful. So then the question would be who, and I think you touched upon this a little bit, but who would be responsible for implementing these policies? You mentioned to some extent that it depends on the scale at which the policy is directed, but who ensures to some extent that they are implemented? Are there any guardrails or any mechanisms in place to ensure that they're implemented?
Yeah, so policies generally they are not very binding documents, as in they are not legally binding, or generally we don't even put in financial, kind of allocations or things like that in a policy.
Mm.
So to that extent, it's not something that you very strictly enforce. It's more a guiding document, it's more a guiding framework. And implementation, of course, in the health sector happens at different levels and different entities. So, in the public sector, you have the government, obviously, and the government at different levels. In a country like India, there's multiple levels at which the government is there. There's national, state, there's local, and other countries also have different kinds of levels depending on the population size, the complexity, etc. So there's the public sector, obviously, then there's the private sector, which is quite heterogeneous in terms of course, you have your hospitals, but you also have laboratories, you have drug manufacturers, you have medical device manufacturers. So there's a whole host of stakeholders that are involved there. At the community level, you have civil society organizations, you have philanthropic organizations that fund a lot of, say, pilot projects, or, projects where you're trying to demonstrate a particular solution in the health space. And then people, of course, the communities themselves, they themselves are a very important stakeholder, the patients, and, even communities in general. So ultimately, everybody is kind of involved. But it's just that the policy provides you a framework. Suppose you're working in non-communicable diseases or you're working in infectious diseases, you at least have a document to refer to and say, okay, these are the targets that the country as a whole is trying to get to. And what do I specifically do in this context, and or what role do I play or my organization plays in this context? So it's a broad guiding framework in that sense. It's not very binding to say that every word that's written has to be done. And generally, that's why policy documents are written also in a fairly broad way. They are not written as that you have to do this. It's more that this is where we want to go, and these are some of the suggested ways in which we can do it. So, yeah, that's how it generally works.
So then is it fair to say that the incentive or the motivation to try and meet those policy goals and for everybody to work towards them would just be that the framework kind of sets out a utopia that everybody ideally should believe in or want to aspire towards, and it's like a belief that this is going to get us to a better place, and the only way we can get there is if everyone in the system is working towards that in some way.
Yeah.
So do you think that that's a fair assumption?
Yeah, it's a bit like the SDGs, right? With the SDGs,
Right.
everybody is in some way working towards some SDG or the other. And yet, it's not like we have anybody to all the time hold each of us accountable and say, okay, what are you doing, to achieve X or Y SDGs? So it's a bit like that,
Right.
where it's something more broad. But then, like I said, you have to crystallize it into your programs or into your schemes, and that's how you bring in the accountability part. So government would have various programs which are running, which ultimately tie into the goals of this broader policy framework. But the programs, the schemes, the initiatives, they will have specific targets, they will have specific funding allocations, they will have specific monitoring. And so the people implementing those will be responsible for achieving those. So it's not a direct way in which you're measuring, but indirectly you are, because even that scheme or that program is somewhere getting derived from your broader health policy framework.
Right, right.
Thank you, Urvashi. That's really helpful context. And obviously, from what it sounds like, there's actually a lot of different stakeholders involved in deriving policy, but also in implementing it as well. And that leads quite nicely to what we're talking about today, which is obviously patient involvement and how patients can get involved in shaping policy. So just before we move into that section, I guess it'd be really interesting to hear a little bit more about your story, how you got into policy, and then what your motivations are for trying to get patient involvement in policy.
Yeah, I'm a public health professional by training. And so, getting into policy was quite a natural choice because government is one of the biggest stakeholders in public health, certainly. And even for the private sector, the government plays a big role in just defining the rules, the regulations, the kind of broader frameworks within which even they need to operate. So there's a huge voice that any government agency has in a public health issue. And so that's what really got me to work in the policy space. And 8 years, of course, I was working at the policy think tank of the government, where I was working on a whole range of health issues, right from insurance to the COVID response to, medical devices and pharma and, all of that, digital health. So I think that was really a very natural thing for me to do, being a public health professional. If you want to have some sort of impact at scale, or at least contribute to some policy making at scale, or even information sharing, dissemination, everything at scale, at least in my context, happens, through the government. And so that was a very natural thing for me. And of course, I think patience. I mean, I've always worked a lot at the ground level. And when you work at the ground level, you work with communities, then of course you realize that most of your learning happens from there. Most of your learning doesn't happen from sitting in a classroom or then sitting in a nice office somewhere. It happens when you're out there with the people you're trying to, make things better for. And so, having patience or having those communities at the heart of everything that you do in the policy space is not a nice to have, but it's a must have, because they are the ones who can really tell you that, this is our problem and this is what works for us or this is what doesn't work for us. So, that learning I had very, very early on in my career, because I used to go out and work, in urban slums in India, where there's a lot of diversity in terms of the people you meet and in terms of the problems they have. And it's a very humbling experience, because you realize that you might have all this fancy education, but it's not you, who can really solve their problems. They are ultimately the best ones to solve their own problems. At best, what you can do is facilitate or enable or provide them certain tools or funding or whatever it is. So I think that is why in this sector, having that ground experience is very important, because that gives you the real perspective. And so that's why I was always very strong about having communities and their voices, having patients. I work with tuberculosis patients in the past. So, having them at the heart of what are really their issues. And then, of course, when I got my diagnosis after that, then a lot of the cancer advocacy also that I do is about getting that patient voice front and center, because ultimately, until you walk in those shoes, you don't know what it's like. So I think we have people sitting in rooms making policies, and nobody's actually, fortunately for them, but nobody's actually gone through that experience. And then I'm just thinking that, what do you really know? So I think for me, it became even clearer, I would say, that you need to have that voice there, not as a nice to have, but a must have, because it's the only way you'll know whether I'm really solving for the problems that the patients or the communities are facing, or
Mhm.
trying to do something which doesn't help them or might be actually harmful or detrimental for them. The only way to know that is by having that voice there in the room, and very prominently, not just a check in the box, but a very prominent part of the whole policy making process, and even afterwards implementation, monitoring. You need to keep checking in that, okay, we came out with this scheme or program for you guys. Is it working? Is it not working? Or what are the challenges once it's being implemented? Often there are a lot of unintended consequences in policy making. So you make a policy with the best of intent, but when it goes out into the real world, things can happen which you didn't anticipate.
Mhm.
So, for all of that, you need to constantly have the people who you are delivering that particular program or that service for to say that yes, it's working or it's not working.
Mhm.
And I think patients, their caregivers, they are some of the best people to really bring in that perspective.
Right, right. I think that you've covered that so eloquently. We hear a lot of stories about people who work in the whole medical industry and then they end up with a condition or an experience themselves where they're
Yeah.
hospitalized, and then they're faced with the reality
Mhm.
and they write stories about how different it was to be on the other side and how stark it was. Did you have a similar experience where you felt that, oh, we've been doing this all wrong?
No, I didn't feel that I was doing anything wrong, because I think I was always very cognizant of a lot of the things that I ended up seeing. It's just that, of course, when you see it yourself as a patient, it is a different experience.
Mm.
And I think one also
Mm.
saw very closely a lot of the gaps in the health system, a lot of lack of training, even in very highly specialized oncologists. There was a slip up on my diagnosis initially, and they thought it's something totally different. And it was just fortuitous. I mean, although it's hard to say that there's good luck when you have a cancer diagnosis,
Mm.
Yeah.
but the fact that somebody even tested for this ALK, the ALK
Mm.
gene mutation, because this one then really gave that little bit of lease of life, because at least for this we do have some medicines.
Mhm.
They are not perfect, they also stop working, and I've gone through all of that as well, but at least there was some lease of life. The initial diagnosis was giving me 6 months to live,
Wow.
and by that time they had not even diagnosed me properly. And I had access to some of the best doctors. I was in the national capital of India.
Yeah.
So for me it was like, okay, this is what is happening even with me.
Mm.
So just imagine what is happening maybe with hundreds and thousands of people out there who don't even have access to this.
Yeah.
So that was certainly, it just became more stark. It's not like I didn't know that before. I obviously knew it because I've worked in this space all through my life,
Right.
but it just kind of hits you in the face and you're like, okay, this is so real.
Right. Thank you for sharing, Urvashi. That's very kind of you to share so vulnerably. I think that it's really obvious the benefits of patients getting involved in things like policy because they impact patients directly. And it would be great to understand some examples of cases maybe where patients have been successfully involved and have advocated successfully to shape policy in India or globally.
I think very close to my condition, one of the earlier patients of ALK positive lung cancer in India. She and her husband, I mean, she sadly passed away after about 7.5 years, but
Mm.
it's a miracle that she even lived that long, because she was without medicines for long periods of time. Because at that point, we didn't even have those medicines in India. We didn't even have those clinical trials in India. We used to only give ALK patients some chemotherapy, and that is actually harmful for ALK patients. So it's either harmful or it certainly does them no good. The oral targeted ALK inhibitors were not even there in India when she was diagnosed, and it was just through the advocacy efforts of her and her husband that not one but two clinical trials came to India. And so, of course, she got those drugs. Although, like I said, it was suboptimal because sometimes 6 months at a time she was without medicines. But still, for whatever time she lived was, I think, just that sheer advocacy, grit, determination. I mean, I marvel to that couple every single day because I think that you are in such a desperately dark situation. It's very hard to advocate for something like I need to bring this clinical trial to India because I know how hard it is to do anything like that, even in normal circumstances. And here you are also fighting, literally life and death every single day. So I think that for me is a great example. And ultimately, what they did, of course, did not just benefit her, but actually it benefited so many more patients, and some of the patients who could get medicines on those clinical trials are still alive. So even though she's unfortunately not with us, those patients are still around, and her husband continues to do that advocacy work. So I think this is like an exceptional example, but it's just an amazing one that, just a patient standing up in a conference and saying, is my life any cheaper than somebody else's? Why do I not have access to these medicines? And she did that in one of the conferences. And so I think just power of that and literally moving mountains after that, which so many times you would have governments, you would have pharma companies, you'll have everybody trying to do things and nothing will happen for years on end. And just one patient and her caregiver, they literally moved mountains, So even when it seems just so impossible, it's still possible. Patient advocacy, patient voices, putting that case strongly, persistently, you can be surprised by what you might be able to achieve.
Wow, that's really powerful. Thank you for sharing that. And yeah, it's a shame it didn't come sooner for her, but obviously it's impacted so many people, as you've said. And that's a really good example, I suppose, of almost lobbying, right? It's about shouting, saying, here's the problem, and even coming up with a solution to say, here's how you can solve it. Let's get this moving. And obviously, I think there is a point to sort of sharing that from a first person experience, saying, this is a really personal thing that happened to me, humanizing it, putting the person who's dealing with it in front of people is really powerful. And like you said before, that's hopefully what policymakers should be doing in terms of speaking to the communities and the people that their policies are affecting. So that's a really great example, but you did speak about how it can be challenging for patients to impact policy. So what are those challenges or barriers to patients being involved in that kind of work?
So I think first is, very obvious where you're patient yourself, especially, these serious conditions where you're dealing with so many things, not just your ailment, but the monitoring that you have to have in terms of your tests and scans, and then you're managing the side effects of your treatment. So it is genuinely hard, It's kind of you're barely scrambling to keep your head above the water, and then to kind of also expect that, okay, you're going to also do advocacy. Sometimes it can feel like a bit too much. So I think that is, of course, a very obvious thing. And not everybody might have the caregivers or the support around them, or they might be struggling with the finances. I know so many patients, right, because of, where I come from, where you're just struggling to even think, how am I going to buy the next set of medicines and where am I going to get the money from? Because if I'm sick, then probably I'm not able to work. So I'm so consumed by my own day to day, life issues that advocacy feels like a luxury, right? In many of those cases. And which is why a lot of those voices don't come forward. And I don't blame them. I can understand that fully.
Yeah.
Because even with my situation where I'm not from a poor family, I'm from a middle class family, but even then the finances for me are very burdensome. So I think that is one very obvious challenge, barrier. Apart from that, I think it's also just having the right tools at your disposal, having the right knowledge that, even when I'm doing advocacy, what is it that I need to say? How do I need to communicate it? To whom do I need to communicate it? How should that messaging be? I always tell a lot of people wherever I go in public health conferences or events that public health at the end of the day is also a political issue.
Yeah.
So if you're going to go to a politician or you're going to go to a government person and say, listen, I want you to lower the price of such and such drug, or I want this trial to come to India, ultimately you need to also show to them what is in it for them. And everybody is not just acting out of the goodness of their heart.
Right.
I always tell patient advocates also that you need to understand that, yes, you are acting from a place of lived experience, deep emotion, but the person in front of you might not be. They might not have ever experienced something like this. They might feel that, oh, what is this? It doesn't really affect me.
Mm-hmm.
And so, how are you going to make them invested in your problem? You have to know what is in it for them.
Mm.
And you need to know how to communicate that as well. So, I think that is another barrier. Even I speak with a lot of emotion, a lot of passion, but I also know because of my training and my policy background, somewhere I also know that if I'm speaking to a politician, then I will speak in numbers. I will speak in vote bank terms, because I know what is going to move him, right? And I think it doesn't come naturally to many of us,
Mm.
and even harder when you become a patient. And so I think, of course, apart from involving the patients in cases where we do have caregivers who are able to perhaps devote a little bit more time to this, and they are perhaps able to, even if they don't have those tools or those capacities today, if they are willing to cultivate a little bit of that, then sometimes even a caregiver can be a very good advocate.
Right.
So I think we can certainly look at how do we just provide simple tools, some initiatives that a patient or a caregiver, given their constraints, can reasonably do. I think that would be immensely helpful.
Right. I have a couple of follow-up questions. One is around whether they're equipped or whether they have the platforms or the tools. But I think what's linked to that is whether they think it's their place. And I think that that's really important
Yeah.
because for most patients, it's not even their place to talk to their doctors or ask their doctors questions.
Correct.
I don't even think that anybody above that level is anywhere in their horizon or in their line of sight. So, how do you even bring that into their line of sight? And
Yeah.
who is meant to think about that? Or how does that even come into play? I guess that would be a huge barrier, right? And that probably on some level links to health literacy as well, which again is a huge gap in India and everywhere in the world. But to a huge extent in India and other developing countries.
Yeah. Yeah. I mean, in India, and I keep saying this everywhere, and I think I'm also hated by a lot of people for this, but I still say it. There is still a mindset that the doctor is like God, so we just can't question, we cannot say anything. And I really go around saying this, that the doctor is a professional, but he or she is not God. They are not some superpowers that you can just never ask a question of. Second opinions, people are so shy to take second opinions because they are like, okay, my primary treating doctor is going to get offended.
Yes.
So I don't know. I don't think that this is so much of an issue everywhere in the world, but certainly in India, this is a huge issue where we just worship the doctor and everything they are doing is like gospel.
Yeah.
So I think this just needs a lot of people to break that kind of mindset. It is happening as people are becoming more aware, and also as people are beginning to pay, right, for a lot of health services, because a lot of the healthcare they are getting is in the private sector where they're actually paying. But it is a challenge, and at least I tend to really say this very vocally, that you have to advocate for yourself. If you have come across some research happening in some corner of the world, your doctor may not be aware of it. So, if you've come across something, please do speak up, because that's the only way the relationship is going to become a little bit more equal. Right now, I think for most people, it's a very unequal relationship.
Yeah.
Yeah, that's really interesting. And I think it speaks to, as a word going around in terms of patient activation, like how much a patient wants to be involved in their care. And obviously, if we're talking about just being involved directly in their own individual care with their doctor, it's then a huge step up to say shaping, even if it's local or national or international policy, is a huge step up.
Correct.
So it sounds like there's two kinds of barriers. One that's sort of internal, like, do I feel like I have the time, the capacity, the knowledge, the understanding?
Yeah.
And then the sort of external part is, how easy is this to do? And it sounds like it might be complicated. I mean, Clarinda and I are both U-Party qualified patient experts.
Mm.
So, it was based on medicines development. But I think that means that as patients, we're quite activated, we're passionate, we understand the process, we know how to get involved. But policy feels like a completely other world.
Yeah, even for us. Yeah.
And honestly, I'm not really sure how I'd even get involved in that. I think that the most I've been exposed to it is working with patient organisations who have lobbied, who have, in the UK stood outside Parliament or gone to speak in the House of Lords to say this is a big issue, and they're raising awareness of it to the right people. And I think that's a little bit similar maybe to the example that you mentioned before, but in terms of getting in on the ground and speaking to policymakers while they're developing or shaping policies, I don't really know how that works.
Yeah.
Yeah. The other thought that I had was with regard to the barriers. We spoke about the barriers from the patient perspective in terms of whether they have the tools and the mindset and all of that. And the other angle to that is whether the system is ready to embrace patients, which is a whole other question. That's a question for you. Are you the exception or are you the norm where you go out into those communities and you actively welcome that involvement? Do you think that policymakers do that in general, or do they not?
I think in general, it's probably not enough of that. Like I said, policy, when I say policy at the highest level, of course, a lot of it still comes from the politicians. And of course, the politicians are interested if the numbers are there, right? And so I always say that it is a numbers game, especially in a country like India. If one person is asking for something, well, it's probably not going to be given much attention. But if hundreds and thousands of people are asking for something, then it's a different matter. And that's why I keep trying to also bring people together, because sometimes individual advocacy might either not be possible or might not be feasible. But if you can get people in groups, right, to at least come together and say that this is a real challenge for us, at least to their local elected representatives when their elections are happening. So I think that is one very important avenue, because at the end of the day, if there's a politician who is in power and they really want something to be done, or they feel that it's going to give them as well certain benefits if they do it because there's large numbers of people demanding it, then it usually does get done, and so that might be a much better way to approach a lot of things than trying to go through the whole bureaucracy or the whole administration, because that's very complex. And also, ultimately, the ruling political powers have, I would say, the strongest voice. So, certainly at the administrative levels, I don't think that there is enough of effort to reach out and really get the community voices. I think even if I look at the bureaucrats, so when they are serving at the district level, which is, district in India is basically it's like a subdivision of a state. And so when they are serving at the district level, then yes, they are much closer to the people. But as they rise in the hierarchy, they go to the state level, then they come to the central level, they moved further and further away. And I think that is the challenge. A lot of people who are holding the senior positions, it's probably been several years, since they've really served at the grassroots level. And so they have moved quite far away, from people in that sense. And it's very individual dependent. If there's an individual bureaucrat who's very interested in getting patients to be there, then it'll happen. But it's not a systemic thing. And in other cases, it might be, like I'd said initially, more of a check in the box that, okay, we need to have one patient voice. So we have one patient voice. Often it's the same person coming everywhere, or, whatever it might be. So it is not systemic, and also very dependent on what is the political will behind this particular issue. Of course, for people going through it, always it's a big problem.
Yeah.
But does the system perceive it to be a big problem or not?
Yeah.
So that, I think, is the biggest battle that one is constantly fighting. Because if you can convince the system, you can convince your political leadership that yes, it's a big enough issue, then I think a lot of things fall into place.
Yeah. So I think what you just said about whether it's worth it in the end for the system, like what is in it for them, I think that that's an important question. I'll just share an example of my only foray with policy. So I live with a rare disease and we have a national policy for rare diseases.
Yeah.
And so I was part of a multi-stakeholder workshop where this policy was discussed, and the policy was discussed after the fact, after the policy had come out, and the policy seems to be a bit of a tick box exercise that the country has a policy,
Correct.
but the policy doesn't really consider the plight of rare disease patients at all, because there are over 8,000, 10,000 rare diseases, and the policy effectively lists about 64 rare diseases. And one of the biggest battles is to get rare diseases recognized in the policy so that patients with those diseases can get the benefit of government funding.
Yeah.
So then my next step was to get my rare disease recognized in the policy. It's a neurological condition and it's recognized in all global rare disease lists. It is a known rare disease with 5 in 100,000 people, the statistics add up and all of that. I put together a document, outlining whatever statistics I could find. I'm not a public health professional or a policy person. I'm just a patient with some training, and worked with a neurologist, put together a case study showing a real patient's case and all the expenses that patient had racked up because of this rare disease. And I submitted that document to the ministry, and then I got just a one-line reply saying that it has been deemed that this condition does not fit the requirements for it to be listed.
Yeah.
And I mean, with no explanation further than that. And that kind of has demotivated me right now to pursue it again for a while. And maybe I will take it up eventually. But yeah, the point being that the barrier to entry seems so high. And just how do you even go about it and where do you start? But I understand the need for the collective effort, and I understand the need for the two-way communication and the numbers and all of that. So, yeah.
Yeah, the thing is that in India, even if we say something is rare, even if it is 1% of the population,
It's
it's still
huge.
huge
Yeah.
in terms of absolute numbers. It would be larger than many, many countries.
Yeah.
So I've always said to people in government and otherwise that, you need to see how you're even saying rare or not rare, or okay, you can say relatively rare, maybe. I think firstly that definition itself we need to see, because I don't think we fully or accurately measure a lot of these things also. And cancer, for instance, it's not even a notifiable disease across the country. So we are not even getting a sense of the full numbers. And on top of that, a cancer which is much harder to diagnose, like mine is. So I think it's a complex thing.
Yeah, and that comes back to what you said before. I think quite a lot of the time, patient advocacy people are thinking about sharing personal experiences and having that emotive storytelling to really make people care and listen. And that is so powerful, it really is. But sometimes when you're talking to specific stakeholders, they can care as much as they want, but if they don't have the data to support implementing a project or writing a policy framework, then they're not going to be able to do it as much as they care. So I think both of those things together, it sounds like, is what is needed for policy. And we've heard that as well with regards to patients speaking to other stakeholders, particularly HTA and regulatory pieces in medicine development, where there's a fair bit of overlap, I think, in terms of the skills maybe that are needed.
Correct.
Because unfortunately, as much as, I might want a whole national policy that'll help me, they also have to think about what policy is going to impact the most number of people or have the biggest impact on the whole of society or the whole of their region or country or even local area. So that's where it's tricky to find the balance, and it's again talking about the skills that are required.
Yeah. Can I just add something on the data part or the evidence part?
Please.
In fact, I've just come up with a policy brief which should get released sometime in May, which is making the case for cancer financing, especially where the drugs are much more expensive, like in the case of ALK. These oral ALK inhibitors are very expensive. But what I said is that if we can make the case and show that, say, somebody like me who was diagnosed at 35 years of age,
Mhm.
if I am able to have these ALK inhibitors for 10 years, 15 years, and there's a lot of people who are very much still continuing very active lives, also contributing to the economy, to the society, everything, very, very normal lives on these ALK inhibitors for 10 years, 15 years, and then research is moving so fast, we never know what might come up in those 10, 15 years.
Yeah,
Mhm.
yeah.
So I said, if we can even do calculation to say that, okay, you might be spending so much on medicines for this person, but you might be also gaining 10, 15 years in terms of productive life.
Mhm. Mhm.
And this person is actively contributing to your economy, to your GDP.
Mhm.
Yeah.
So are you not getting back that return? You're getting it back. And so this person is not a sunk investment, it's a very
Absolutely.
worthwhile investment, as opposed to if you lose a 35-year-old, you've lost a very important part of your workforce, your economy, everything. So I think we also need to try and make the case in some of these ways.
Mhm.
And that's what I've tried to bring out in this policy brief, that don't just look at the cost, look at what you'll also get in return if this person does end up living that much longer.
Mhm.
I look forward to reading that.
Yeah, absolutely. Great. So we've spoken a lot about, I guess, the barriers, the challenges, some of the needs, and also the value of getting patient involvement and shaping policy. Are you aware of any initiatives looking to help with some of these challenges, overcome them, to ensure that patients are more actively involved in shaping policy?
Yeah, I think some initiatives are happening. A lot of it still comes from the civil society, from the NGOs, from
Mm.
different patient groups. I know in ALK itself, for instance, which is my condition, there's very active patient advocacy groups, not just in India, but internationally.
Mhm.
We need more patients, and I think that is happening largely through the efforts of such groups. So I think we need a lot more of that. We need it to be more organized and to really have that strength of numbers, to also have the strength of negotiating power, right? Bargaining power. When you say that I have 100 or 1,000 patients of this condition in my group, or associated with me, then there's also a certain negotiating power you get, as opposed to if you're just individual. So I think it is happening. A lot of it is specific to particular kinds of conditions,
Mhm.
particular geographies. But I think we need a lot more organization. We need it to be more systematic. But hopefully, we are going in that direction more and more now.
I think the WHO is also pushing a lot for more meaningful engagement of people with lived experience.
Yeah.
And they've been doing a series of symposiums in that direction to engage people with lived experience. And I suppose that after the World Health Assembly, maybe that could get incorporated into members' policies, and then maybe that becomes part of government and regional policies to adopt more people with lived experience
Yeah.
into policy frameworks.
Yeah.
Do you see that happening in some way?
Again, see, WHO also is like, I mean, they can't enforce anything really.
Right.
Mm.
So ultimately, it's up to the individual countries what they do with that.
Right.
And so I still feel that, of course, it'll be good if they do it, but I don't think it will have that enforceability. That will still have to come at the country level,
Right.
or in a country like India, even at the subnational level. And I think that importance of that, like I said, will only be understood when we're able to make the case very strongly for why you need this. And, we have to keep interacting with people in the system and saying that, look, you're making all these policies and programs, but you don't even have a patient telling you whether it's working or not working. So, you might be wasting your money on something that we don't need. So I think that messaging has to keep going constantly. There's no quick solutions for these things.
Yes.
But I think if the messaging is A, consistent, and B, like I said, the numbers, the organized
Yeah.
voice,
Yeah.
that is very important.
Yeah. Okay, thanks, Urvashi. This has been so insightful and I've enjoyed every bit of this conversation so far.
Mm.
Let's move on to maybe what's your long-term dream for health policy in general?
Well, I think most importantly to be equitable. I think that's what got me into the public health space, that every single life, every single person, regardless of where they come from, what's their income level, what's their education level, everybody should have access to at least a certain basic quality of health services. And I think coming from a country like India, that's really our biggest challenge. But I think it's true for many places in the world where there's still a lot of inequities, and a lot of what you can get access to or what you can afford ends up determining your health outcomes. And I think that is quite unfair, because everybody has the right to certain basic health services, and that should be just regardless of where they are or who they are. And all of this should no longer have to be a factor. So it's a very, very utopian
Mm,
kind of thing. But I think for me, that's what got me in this space. That's why I'm still in this space. And that's why I still speak for people who are not able to speak at platforms and come and speak here like this. Because I do think that each of those lives is as valuable and there's really no difference. So I think that's what I would want to see health policy, the health system, to eventually be able to achieve that. We need to really do away with these stark inequities that we currently have.
mm, mm.
That's a great dream. And, I hope that one day we do get to see a world that's like that. And just want to comment, it's just a thought that I've kind of had throughout this conversation, but specifically then when you said about equity and everything. Health isn't just about making change in the healthcare sector. Healthcare is also impacted
Correct.
by education, it's impacted by economic status, it's impacted by culture, society.
Absolutely.
I know we've been talking about health policy, but it's just a thought that actually health is impacted by so many more things.
Mm,
And
Correct.
I think you've mentioned a few times that all of the different sectors, they have an influence on this kind of thing and they need to be involved in health policy, and health policy can touch so many different areas of society.
mm,
Yeah, I mean, everything. I think agriculture, food,
Yeah.
nutrition, air, environment,
Hmm.
everything. And it was so interesting. We had done a study on how road access, road infrastructure was one of the biggest contributors to improvements in maternal mortality
Wow.
in a certain part of the country, because now people with high risk pregnancies or complicated pregnancies, they could reach the health facility in time,
Right.
because earlier there was no roads, and they could never reach on time, so their lives couldn't be saved. And
mm, mm,
so it was amazing, right?
Yeah.
We talk of all the health related things, but actually it was the road infrastructure
mm,
which
Wow.
was so critical. And so I always say, when people ask me, what do you work on? I say, well, I work on a whole host of things, because
mm.
public health is
Yeah.
intersectoral. By definition, public health is not just one sector. It is multiple sectors. It is gender, it is nutrition, it's education,
Mm,
it's
mm,
social justice, it's
mm,
economic empowerment,
Hmm.
and it's infrastructure of all kinds, environment and infrastructure.
mm,
So it's also why it's so complicated.
Yeah.
But yeah, I mean, that's the nature of the
mm.
space.
Amazing.
Wow, that example gave me goosebumps. The fact that the roads affected the neonatal mortality, that's brilliant.
Yeah.
So I think we're almost at the end of this conversation, and I don't want it to end because it's just been so good. I've enjoyed it so much. Thank you, Urvashi. Can't thank you enough for all the insights, and you've just been so fascinating with everything that you said. For the last bit, we just asked for your advice, and I think first our question would be, what would be your advice to get policymakers to think more about patient experience when creating policies?
Yeah, I think policymakers need to realize that whatever they're doing is not of a lot of meaning and lot of value unless they know that the intended audience is actually benefiting from that and is not being, like I said, in some cases even harmed by that. So if they are making the effort of making a policy, putting money behind it, putting resources behind it, then it is absolutely crucial and it makes all the sense in the world for them to have whoever is the intended audience for that, recipient of that, be there throughout the process and not be there just as a token, but be there as a very active voice, because they are the ones who would be able to tell whether course corrections are needed, whether things are working, they are not working. So it's something that is very important for policymakers to understand, that, if you're making all that effort to make a policy, you may as well know if it's actually working or not.
Absolutely. Thank you, Urvashi. And just for the last question then, so on the other side of that, what would be your advice for individual patient advocates or patient advocacy groups looking to get more involved in policy?
I think, firstly, I would say that maybe I would promote more of the collective approach,
Mhm,
because it might just be easier, more feasible, more powerful.
mhm,
You might see the needle moving more quickly in a shorter period of time. So, yeah, by all means, there's nothing obviously wrong with doing things at an individual level. But I think the collective has a power. So, wherever possible, I would encourage in that direction. And of course, I would say, remember, it's always political. Health is always political.
mhm,
So connect with whoever it is, whether it's your local elected counselor or local elected leader, whatever you might be. It might be a mayor, whatever level that you can get access to.
mhm,
Doesn't always have to be the health minister or the prime minister of the country or whatever. They're often too busy and have too much else going on. But if you can get hold of, and like I said, a reasonable number of you can get hold of even someone at a lower level who might have enough of that voice. And usually, I think an elected representative or a government person who's influential enough is the right one to kind of target and say that this is why this issue is important and this is why you should focus on it, and this is why you will earn a lot of goodwill if you actually do something to help patients or to help these families. So, really make the case for them. Yes, go with your stories. Yes, go with your struggles, your pain points, but don't let it be just about that. Also tell them what's in it for them. What are they going to gain by caring about this issue, by doing anything about this? So, make sure you also have very clear points on that front. And like I said, if you go in numbers, nothing like it.
mhm,
Any individual never going to be as powerful as a group of people saying we really, really need this. And try to see how you can leverage the medical community. Like, I'm trying to push oncologists in India to
mhm,
come together at some level and say that, listen, air quality is really bad and that's causing a lot of cancer cases in non-smokers. So I'm pushing them to say that, can you guys come together and maybe write a letter to the government, because one of you writing again versus 100 of you writing is very different.
mhm, mhm,
So maybe you can also leverage, if you have a helpful doctor, somebody who's helpful, who's friendly, who's willing to help you out, then you can try and leverage that power as well. Because it's true in India, maybe it's true elsewhere also, that the medical communities, the doctors tend to be quite an influential voice. So if you can get them together, or you can, at least get a few of them together, then maybe that could be another way to also reach out to the decision makers. So, yeah, I think these are some of the routes that I feel like one can try.
That's given me so much food for thought, and
mhm.
it's given me almost like a roadmap for my resubmission on the rare disease policy, because I realized that I A, submitted it as an individual, B, I did not frame it as what's in it for them at all.
Yeah.
And I love all the approaches that you're using, that you mentioned for your own condition. And I think that's a brilliant example that I can learn from. So thank you for that.
Yeah, really
Sure.
great advice. And thank you for demystifying policy for us a little bit and showing how powerful it can be for patients to be involved, and also hopefully how that can be done in a way that really resonates with policymakers to make change.
Thank you so much, Urvashi. We've loved having you here.
It's
And
been amazing. Thank you.
Yeah, great conversation. Thank you.
So, Caitlin, for this last bit, I thought that you and I could reflect on that conversation with Urvashi. I learned a lot. It's not a topic that I've been super familiar with, but it was an eye opener for me. And I'd love to hear what some of your reflections were.
Yeah, definitely. And again, policy isn't something that I'm super familiar with either. So it was really great at the beginning to talk about defining what we mean by policy and health policy and who are the players involved. So
Mhm.
obviously, there are several levels of health policy from a global international level right down to a small region and understand sort of who the different stakeholders who are involved in that. So obviously there are policymakers, members of government, there are specific organisation, and that will change per region. So I guess it's worth looking into who's making policy where you are. But what's really cool and what Urvashi talked about was, of course, getting people in who are on the ground living with whatever policy you're talking about. So in health, of course, that does include patients, which is something that's really great. And
Mhm.
hopefully more and more policymakers will start to involve patients as well. And I suppose one thing that I've always wondered as well is about what policy actually guides people to do because it's not law, people don't have to do it, but it is
Yeah,
guidance. And I think because it's quite high level, usually the policy can therefore be leveraged into action. So
yeah,
if you want to achieve something as a patient or as any other stakeholder in the healthcare system, you can say, we want to do this and it will support making us achieve this policy. So I think that's something that can be really powerful.
yeah.
And of course, if patients are involved in making that policy as well, then those two can work in tandem to say, let's make a policy that aims to achieve what we want to achieve. So it's something that's really powerful. It can be leveraged and not just in health, because there are policies for all sorts of things. I think an example we were talking about was road infrastructure and how a policy for that can actually impact health as well. So
Mhm.
you can look beyond health policy and look at wider policies in other areas as well that could impact health
Right.
in order to drive better health outcomes.
Yeah, I think that road infrastructure example was really cool. And it's been a bit of a recurrent theme across
Mhm,
episodes for us where we talk about involving the people you're building for. And it seems really obvious, but it's clearly not done enough, definitely in the health sector.
mhm,
And the cost to not doing that, to not involving the people you're building for, especially
mhm,
when it comes to something like policy, is literally to the tune of billions and billions of dollars of taxpayer money. Because imagine you've built a health policy that has not really involved patients and does not really talk to their needs and requirements. And then you're trying to implement that, but it's not really solving for a real need. That is billions of dollars of money wasted. So I think from the policymaker perspective, the need to involve patients and speak to people on the ground is critical.
mhm,
From the patient's perspective, I've always felt that policy is something that's so far removed from me. And, there are these powers that be that are pulling strings and determining the shape of our health system. But after this conversation, I feel like there are things that I can do to perhaps change things. And we heard from Urvashi some really powerful stories of how small people in small places were able to do big things to set a ball in motion, which created a snowball effect, and then were able to bring about big changes to policy. So, yeah, a lot of patients can potentially take away something from that and think about how they can make an impact, start small, start somewhere, and work towards making those changes.
Yeah, absolutely. And I think another recurring theme that we've had maybe with other episodes is that while as a patient you do have expertise in terms of your experience and you can share that, and actually storytelling in that sense is
Yeah,
really important because policymakers want to know how people are living every day and they should be impacted by stories they hear from within their society. There is also that other angle of needing to speak their language because they'll,
yeah,
of course, care about your story, but if they think that you're the only one, then they probably will allocate their limited resource and capacity to a problem that they see affects a bigger proportion of their society. So that's something that's
yeah.
particularly important with rare disease, for example. And we've kind of discussed
Yeah.
that before in terms of rare disease policies and how policies lean more to more common diseases like common cancers. So you also have to speak their language and bring that data forward. So say, this is how many people are living with it. It's not just me speaking about my personal experience. There's more voices out there, and this is where groups and societies can support with that. There's also bringing that data about money, the economy, how people are contributing to society if you improve their access to healthcare, whether they need disability benefits, whether they need carers, whether they can contribute to the economy, that kind of thing. So it's really about the wider picture. And if you can bring those two things together, the storytelling and the data, then that's where it becomes really powerful.
Absolutely. So effectively, there's strength in the numbers that you bring in terms of people and in terms of data, both.
Exactly. I love that. Thanks so much for listening. This has been Not Just Patients with our guest Urvashi Prasad and your hosts Caitlin Rich and Clarinda Sureja.